We're joined today again by Dr. Emily Godbout, an Infectious Diseases Specialist and epidemiologist here at CHoR. And we know you have a lot of questions about COVID-19, so we've asked for some of your most frequent questions, and Dr. Godbout is here to answer them. If you can start by just giving us an update, do you have any new information about COVID-19?
Yeah, so since the last time we talked here, a lot of things have changed. We now have more cases of COVID-19 in the U.S., and we now have confirmed cases of COVID-19 in the state of Virginia and in our community as well. But still at this time, I want to reiterate what I said last time. Based on the available evidence that we have, children oftentimes have more mild infections than adults, and we don't have any information to say that children are more susceptible to the infection. And in fact, children and infants have been sick with COVID-19, but adults make up most of the known cases up till this point.
Okay. So speaking of kids a little bit, let's focus a little bit on pregnant women and babies. Are pregnant women at a higher risk for contracting COVID-19?
That's a great question. So pregnant women experience changes in their body that can put them at increased risk for infections. But to date, we have not seen that COVID-19 leads to any adverse outcomes in pregnant women or in their growing babies. But because we know that pregnant women are at risk or are prone to some viral infections, we certainly want them to take all the appropriate precautions. And this would be things like staying away from people that are sick, making sure that they have good hand hygiene, and then practicing social distancing.
Great. And how about if a new mom is home with their baby or in the hospital and they have questions about breastfeeding? If a mom tests positive for COVID-19, should she continue to breastfeed?
Yes. So we are still learning more about how COVID-19 is spread. But person-to-person spread is thought to mainly happen via respiratory droplets, so essentially when an infected person coughs or sneezes. So there's no evidence to suggest that the virus is found in breast milk at this time, and this is just in limited cases that we have. So if a mother has, we're worried that a mom has it, or we've confirmed that she has it, she can still breastfeed her baby, but we would want to make sure she's washing her hands before she touches the baby, and she's wearing a surgical mask if she has the baby clothes or is nursing the baby. We're a breast-friendly hospital, and we encourage breastfeeding. There's a lot of great antibodies and nutrients in breast milk.
Great. So you're a mom of two. How about all those toys at home that kids are sharing, touching after daycare?
Yeah.
Do you have any toy cleaning tips?
Yeah, so before we even get to the toys, I think it's important to remember to sort of clean and disinfect high-touch surfaces in your house. And those do include toys. But things like the table, doorknobs, remotes, light switches, areas like that. And then some of your hard plastic or metal toys, we should be frequently cleaning. And some of that sort of based on how often your child is using that toy. If it's visibly dirty, you want to use some soap and water to clean that off. Use a clean towel to sort of remove that, and then use any sort of standard disinfectant. Usually we like to let it sit for about 10 minutes or more, and then after that sort of wipe it with a towel. And if it's something you think or anticipate they're going to put their mouth on, or in a food prep area, you probably want to just wipe it again clean with a little damp cloth. And then we have all those stuffed animals and plushies and blankies that our children have. My children both are blankie girls that they carry around with them. So those plushy type of toys, we do recommend laundering them. You don't have to do it every day, but sort of coming up with a schedule to do that, and using a warm setting on your washing machine and then letting them completely dry.
Great. How about smartphones and tablets?
That's a great question. So these definitely need to be cleaned. So we recommend turning off your device, and then you can use a disinfectant wipe to clean those devices. And there's actually some companies that have put out instructions specifically how to clean these devices. And I think even Apple has done that recently.
Great. So schools are closed, but some kids are still in daycare. Mom and dad might be a nurse, a doctor, a police officer, somebody who's really just got to be at work. Folks keeping our grocery stores open. What recommendations do you have for keeping kids healthy if they're still attending daycare?
That's a great question. So really it all comes down to infection prevention measures. Really, if your child is sick, they should not go to daycare. There should not be sick children attending daycare. And we really just want to hone in with our children and our daycare centers to make sure that we're practicing good hand hygiene, good cough etiquette, that they're cleaning all their high-touch surfaces and their toys, making sure that, again, if a worker is sick, that they're not going, all of those good things.
Great. For families, a lot of families are at home with their kids, or maybe trying to avoid crowded places. What supplies do you recommend that families have on hand during times like this?
So it is a good idea for families to have some supplies at home because you might be in a situation in which you're home for a period of time. So for medications, I would recommend having a supply, 30-day supply of a prescribed medication. And then I would recommend getting some over-the-counter medications or medical supplies, things like tissues, Tylenol, Motrin, just to have on hand. And these are things that you can use to help treat fevers or other respiratory type of symptoms. And lastly, you want to make sure that you have some household items and some groceries on hand for probably up to about a 2-week time period.
So should families limit outings and gatherings during times like this?
Yes, so families should definitely be limiting gatherings with large numbers of people. And in fact, Governor Northam came out yesterday and essentially announced a 10-person gathering ban. So you've probably heard of the term social distancing. So it's essentially deliberately increasing the physical space between people to help avoid spreading illness. And as everyone is probably seeing, Shira and I are actually now sitting a little bit further apart to practice social distancing. So you really want to try to stay 6 feet away from other people, and this lessens your chance of acquiring COVID-19. The hope with social distancing is to really stop or slow the spread of disease, and this will allow a healthcare system to more readily care for patients over a period of time. But social distancing doesn't mean social isolation. There's been a lot of really creative things that I've seen recently that people are doing. I know that families are having virtual play dates. There's been a lot more FaceTime people are doing with grandparents. I had my kids outside this weekend. I had to do chalk in the driveway. I had to run around the house. So you'll have to sort of get creative with some of the things that you're doing with kids.
Great. So if one member of the family tests positive, what is the best way to quarantine them at home so that the rest of the family stays healthy?
Mm-hmm. So as much as possible, the infected person should really try to stay away from the other members of the family. If possible, if they could stay in a specific room in the house, use a separate bathroom, and also avoid sharing personal items, things like cups, utensils, and bedding. And then again, we go back to those good infection prevention measures. We want to make sure people in the house are washing their hands, having good cough etiquette. And when I say good cough etiquette, I mean, and again, this is difficult in young children, but things that we can certainly practice: coughing into a tissue, discarding it and washing hands, or coughing into your elbow. Sometimes I can get my kids to do that, but washing your hands afterwards. If you have at-risk family members in the home, such as older adults, we are really trying to recommend to keep them away from the affected person as much as you can. And if you do have grandparents, and even if you're not sick, this is sort of a time that we're saying, maybe to avoid some of those kisses and close cuddles.
Right. So we've talked about keeping everybody healthy at home. Should families be worried about contracting COVID-19 while they're at CHoR?
Absolutely not. Here at CHoR, in both our ambulatory clinics and in the hospital, we're taking multiple infection prevention measures to really ensure the safety of our patients and our families. So we've recently made some changes to our visitor policy. We're making changes to the way that we triage patients, and we're doing other things in our healthcare system to ensure that everyone is safe. And here at CHoR and at the VCU healthcare system, we oftentimes treat people with all types of infections. So we are well equipped and prepared to take care of people with lots of infections.
Great. We had one mom write in with a question. It's pretty specific. She has a child who uses an inhaler prior to heavy physical activity or right after for coughing. does that put her son at risk for developing complications from COVID-19?
So again, of all the evidence and data we have out there so far, what we've seen is that children oftentimes have more mild symptoms or more mild illness. There hasn't been any data to suggest to us that children with comorbidities like asthma, for example, would be at increased risk. But one thing I would recommend this mom to do is probably reach out to the primary care physician and sort of talk that through. And I'm not sure if the child has a diagnosis of asthma, but again, I would want to reassure this mom at this time. We don't have any data to support any more significant disease in specific children or patient populations in children.
Great. For families that might have a lot of questions, or for families that feel like this is a high anxiety time, do you have any tips for helping them stay calm?
Yeah, so there's certainly a lot of anxiety right now. It is a really stressful situation. And so just like the last time we talked, I want to try to remind everybody to remain calm during this time. And I think as a parent, if we're able to remain calm and confident for our children, that they'll see that and they'll sort of model some of that behavior. And I think also as a parent, it's important that we have credible information and we're looking at credible resources. So you can sit down with your child or your teen, ask them what do they know about COVID-19, if it's appropriate, and then fill in any of the questions that they have. I think letting them know that they are safe is very, very important. As much as possible, I know that school is out, but trying to create a routine and trying to stick to that routine will help with some of that sort of normalcy. So it's important for us to be good role models for our children during this time, but it's also important for us to take care of ourselves. So don't forget about yourself. So you can't take care of other people if you're not taking care of yourself.
Right. And we're working with Dr. Sood at our Virginia Treatment Center for Children to put out a post soon about mental health during times like this. So
that would be great.
We just ask that folks stay tuned into our social media for that. And lastly, before we end, if you could just give us a reminder on the proper way to wash our hands.
Of course. So we always want to remember to wash our hands after we cough, after we sneeze, before or after eating or using the bathroom. So ideally you would use soap and water, lather up for 20 seconds. And I think last time we talked about singing happy birthday twice or baby shark twice.
There you go.
Or some sort of song. Make it fun for your child, encourage them, give them a lot of credit when they're doing it. If you're unable to wash your hands, you don't have a sink available, you can use a hand sanitizer, 60% alcohol, but if your hands are visibly dirty, we do recommend washing. And when you're washing, whether you're using soap and water or a hand sanitizer, you want to make sure you're getting all your surfaces, so front, back, between your fingers, under your nails, and your thumbs.
Great. Well, thank you so much for answering some of our frequently asked questions and joining us today. We'll have continued updates from Dr. Godbout, so be sure to keep following us for those. Thanks.